Mr. Speaker, 1 in 5 Canadians will experience a mental health problem in any given year. The most common of these is depression and anxiety. The fastest growing cause of disability costs is depression. Evidence-based psychological services delivered by qualified providers have been shown to lead to less relapse of depression when compared to treatment with medication alone. Will this NDP government consider including psychological services under Medicare, as physicians are covered, as a Liberal government will do to improve treatment for depression in Manitoba?
I thank the member from River Heights for the question. He needs to know that the support for mental health services and regional health authorities has tripled from $50 to $150 million. I hope he will recall that Manitoba is the first jurisdiction to bring in post-traumatic stress disorder services as a coverable support under the Workers' Compensation Program, and it's a service that's available to all the working people in Manitoba, whether they're frontline service providers, whether they're teachers, whether they work in a convenience store, whatever their particular occupation, they will have access to that service if it's connected to their on-the-job stress, Mr. Speaker. And as well, the member will know that we have very active a crisis response unit at the Health Sciences Centre for anybody that is in mental health distress. That unit is a full-service operation with psychologists, social workers, psychiatrists, and of course health professionals that are there to fully look after people when they come in. It's a specialized unit. It's unique in Canada. I'm proud that Manitoba was the first province to bring that in, and I'll give them further information in the subsequent questions. Mr. Speaker.
Mr. Speaker, as the Premier should know, publicly funded services in this area are often in short supply and with very long wait lists. And coverage is often too low for clinically meaningful amounts of psychological therapy. Manitobans either pay out of pocket or rely on private health insurance plans provided by their employers. Including mental health services under Medicare, like physician services, is the right thing to do, and a Liberal government will do it. Why won't the NDP government do the right thing?
Speaker, I do appreciate the question. Mental health services are an important dimension of looking after Manitobans' well-being, allow them to support their families, participate in labour markets, and be full members of our community. And that is why we are doing things in the schools, for example, the Roots to Empathy program. It's a very significant program for young people to learn how to relate to infants and learn how to connect emotionally with people, lessons that stay with them their whole life. The PACS program that we're doing in the public schools is teaching young people the skills of being able to understand their own emotions, how to relate to others without entering into violent conflict. We have programs in the schools, including the RESPECT program that was pioneered by Manitoba athletes, and we're working with our teachers, we're working with our schools. The Child Guidance Clinic provides psychological support to the schools. Many school divisions have their own psychologists that they've engaged to do that. We want to be on the front lines and help people develop that kind of resilience that will help them deal with the great challenges of life and people growing up. And one of the things I was really impressed with this fall, Mr. Speaker, was being with a group of young people from all around Winnipeg that were doing suicide prevention programs, peer group programs, to help each other deal with some of the challenges of being young people in a very dynamic and stressful society today, Mr. Speaker.
Even with the services the Premier talks about, there are still far too many people who have a mental health problem each year. Mr. Speaker, research has demonstrated that psychological treatments are effective in helping depression, anxiety, eating disorders, substance abuse, and autism. Psychological services are just as effective and less costly than medication for many mental health conditions. These therapies can help lower suicide rates among individuals with bipolar disorders and prevent relapses in those with schizophrenia. Why does the NDP hesitate to include psychological services under Medicare, as a Liberal government would do?
Mr. Speaker, as I've indicated, we've tripled the support for mental health programs in our regional health authorities. We've brought many more additional drugs onto the PharmaCare program, which is the only program in Canada that's geared to income and allows people to have affordable access to drugs that will help with mental health issues, Mr. Speaker. We've put in place many housing programs. I was just driving in the Wolseley area the other day, and I saw emerging there a brand new housing project for people with mental health issues, who will live with other people in the community and have stable housing. These are important initiatives on our part. We support the self-help groups in the community that provide mental health services and support, and we support young people, and we support young people in school when they provide leadership to provide peer support to each other. We also have the PACT program in the community, Mr. Speaker. We believe in community-based programs. Clearly the members opposite who want to cut education budgets don't want to hear the answer, Mr. Speaker, but what we're interested in is the kinds of community-based programs at the front end that prevent and help young people be more resilient, and we're interested in programs in the workplace that help people be more resilient. And if the members opposite really want to support this, they would have voted for the anti-bullying legislation, which is one of the best ways to help people have a sense of belonging and be treated with respect in their schools. And it's shameful that the members opposite...
Order, please. The Honourable First Minister's time on this question has elapsed.